Hi, welcome to You and Your Health. I'm your host, Dr. David Bertone. Today we're going to meet with Dr. Tom Bilella. Dr. Bilella has a program utilizing nutrition and counseling to address weight loss. As we know, obesity is a big problem in this country, and there are many different programs out there to address weight loss. Dr. Bilella's program has been highly successful in the area and helping people lose weight and live a healthier lifestyle through nutrition and coaching. Dr. Bilella, welcome to the show.
Hey, great to be with you. Great to be at my own old professional stomping ground. I had a very successful chiropractic practice right here, Old Bridge, Matawan border, so it's good to be back.
Great, welcome back. So
Thanks.
Tell us about your background and how you got involved in this.
Yeah, so started practicing chiropractic when I was 24, which is going back a few years, and went and got my master's in nutrition. I always had a passion for that. But really my real story starts 40 years ago. My mom, as you know, you've taken good care of her. When I was 11, she suffered a low back injury. It was a disc injury. Mm-hmm. And bottom line is, back in those days, conventional treatment was traction in the hospital and meds. And she was there for, felt like weeks, not getting any better. Fortunately, and she was on anti-inflammatories and painkillers and not getting better. It was a pretty scary time for us as a family. Mm-hmm. Someone recommended a chiropractor, Dr. Bill Kelly down in Brooktown. I still remember, I was 11 years old. And through chiropractic and nutrition, she got better. He also helped me. But when I was sitting as reception area one day, I picked up a pamphlet. It said, "The doctor of the future prescribed no medicine, but interests his patients in the care of the human frame, diet, and the cause and prevention of disease." I read this, it was like an epiphany. I said, well, I'm going to be a chiropractor, and I'm going to do nutrition, and that was 40 years ago. And here we are today. I sold my chiropractic practice to a great guy, Dr. McGuire, about 8 years ago. And now I have my nutrition treatment center down in Red Bank.
And you're one of these guys that has so many letters after their name. So you've gotten a lot of certifications, and so tell us about this certification to become a nutritionist per se,
yeah.
and how you got involved with that.
Yeah, so I have like 4 certifications in nutrition, including a master's degree, which was from University of Bridgeport back in '92. I'm a certified nutritional specialist, certified clinical nutrition. So I dedicated my life and studies to learning as much as I can about clinical nutrition. I'm also a sports nutritionist. I actually worked with the New York Jets for 2 years back in 2009, 2010 when they were successful, the early Rex Ryan days. So basically I just kind of made it my passion to learn as much as I can and ultimately help as many people as I can live a healthier, more productive life without the use of unnecessary drugs and surgery. Because as you mentioned earlier, obesity is a crisis. I call it diabesity. Mm-hmm. 140 million people in this country are diabetic or pre-diabetic, and we got to do something about it, and drugs aren't the only answer. There's too many people just taking drugs when they should be looking at their lifestyle, their nutrition, and their diet, and that's our passion, and that's what we do at Nutrition Treatment Center.
Great. Now, you have a program that utilizes several components. So can you explain basically how the program works through these different components?
Yeah, so what we explain to our clients and the approach we take, our core concept, if you will. Let's say you're a bicycle. Every bicycle has a back tire and a front tire, obviously. So the back tire, to me, is their lifestyle, their nutrition, their exercise, their water, and their rest and recovery. And we say nutrition, that's their food and their nutrients. So that's their back tire because you're in control, you're pedaling. You see, and a lot of people don't know what to do with that component because there's so much confusing information out there. Mm-hmm. So we look at their lifestyle, we help them with that, we educate them what to do. The front tire is your chemistry, okay, and that's a very important component of what we look at. Your adrenal function, your thyroid function, your hormones, food sensitivities. So when we look at a comprehensive approach to our program, which is what we do, we look at your lifestyle and we look at your chemistry, and we utilize functional chemistry and food sensitivity testing and vitamin mineral analysis to personalize someone's program.
Awesome. So when you talk about functional medicine, is that the combination of the front and back tire?
Yeah,
or how would you describe
functional medicine today, as opposed to dysfunctional medicine, which is, basic blood work, diagnose and adios and take a drug. That's what's happening in too many cases around the country today. But functional medicine is just going deeper labs and getting the right coaching to find out, more than just a basic panel for blood work, looking at the adrenals, looking at the thyroid, looking at your subfractions for your cholesterol, and then incorporating a sound, personalized lifestyle program to approach it.
You say lifestyle. Obviously, the importance of somebody's lifestyle and changing that is very difficult, and I would assume that's where the coaching comes in, right? So you can analyze it, see what the problem is, But then sometimes you need a little help with that lifestyle change.
You need a lot of help, and that's why I have such a great team. I have nutritionists and health coaches. See, here's the problem. Food today, especially like sugar, has hijacked our brain. And there are flavorists out there who are working for these big food companies. They know what they're doing. They're actually manufacturing and making this food to be addicting. So that's one reason why it's so hard to make the lifestyle changes. Not to mention everyone's so busy and it's hard to eat clean. So that's really what we pride ourselves in at Nutrition Treatment Center, is the effective coaching with myself and my team. So we actually personalize it, and we do it over a step-by-step process so we don't overwhelm you. So I call it emphasize and minimize. You know, we're going to emphasize what you got to start to do and minimize the bad stuff.
Yeah, I mean, this is compared to some of the other practices that might use some pretty potent medications or weight loss surgery, the bariatric surgery, which is becoming very popular now, right?
Yeah, and listen, some people need that. Some people, you have to go to that extreme. But in many cases, we find, I've helped people lose over 100 pounds before with respect to our methods and the coaching, but of course it requires the compliance. And what we're really good at is that we do care calls. We call you up. We make sure you stay accountable. We do seminars. We make you keep a food journal, okay? But we make it fun. And then with our program, we have a body comp analysis machine, a $10,000 machine, state of the art, that tracks your progress. So every time someone comes in, we get them on the machine. We can make sure you're keeping your lean body mass and burning fat, especially the visceral fat, which is which is the problem.
Yeah. So let's talk about things like body composition. What do you do the first time you see somebody? Like, so an initial evaluation, they come to you, Dr. Tom, I'm really struggling. I need to lose some weight. What's that process like?
Yeah, so the process starts with some paperwork. Of course, they bring the paperwork, medical history. So they come in, and then obviously we talk about their goals. We talk about, past history. We talk about family history. And we get into the big why. One of the things I always do is like, hey, Mr. Jones, why is it so important you lose body fat? And then when we get that big why, then we have some leverage. We can work together, facilitate change. Then we do my nutrition exam. I can look at someone and get some insight, but I got to crack them open. Okay, so I'm going to look at their skin, their hair, their nails. We'll do anthropometric measurement. We'll measure them. Of course, do the body comp analysis. But what's critically important are the labs. So I'll do the functional chemistry, thyroid, adrenal, cardiovascular type testing with respect to lipids. What's really important is looking at someone's vitamin mineral status. So that's a blood test called SpectraCell. And then most of our clients elect to do a food sensitivity test, because you could be eating a benign food, chicken, lettuce, rice, but we do a food sensitivity test and you may be sensitive to that food, which creates inflammation in the body called silent inflammation, which you don't feel. And if your body is fighting inflammation, you can't burn fat. So what I'm saying is, we do the assessment, we meet them where they're at, we find out what their goals are, but I rely on the labs. Then after their labs are reviewed, they come back for the second visit, and we launch their program.
Okay. So blood work, extremely important. That's done during the first visit?
They'll usually come back. I do blood work on Mondays in my office, so within 3 to 4 days, they'll come back and we'll do blood work. We have a phlebotomist that comes in.
Great. And then, so explain the body composition, this machine you talked about. What is that measuring, and what's the benefit of that?
Yeah, so you stand on it. It's a $10,000 machine called the InBody 570, and it's bioelectrical impedance, and it works like this. Muscle is about 75% water, so it's a good conductor of electricity. Fat's an insulator. So you'll stand on it. It's a microcurrent. You won't feel it. It's 3 different frequencies going through your body, and it's 99% accurate compared to DEXA testing. And what this will tell us in 30 seconds is how much fat, how much muscle, how much water's in your body, and segmentally. It goes leg, arm, trunk, and can tell us how much muscle's in each segment of your body and where the fat is. So that becomes very important because it comes down to percentage of body fat. BMI is your height, weight, which is okay to know, but the average linebacker or running back in college is 33.8 on a BMI. That's obesity. I'm obese, okay, because we're carrying a decent amount of muscle. So that's not the right reference. The right reference is a body comp analysis, and just because you lose weight doesn't mean you're winning. If you're losing weight and losing muscle, that's a problem. So we want to make sure you're getting enough protein, you're getting enough calories. So it starts with the body comp analysis, and every time someone comes to my office, we repeat the test.
Can you explain the BMI, what that means,
Yeah.
and why is that used as such a standard?
Yeah, it's body mass index, which is really height weight. It's this fraction, you do a division, and it's your height and weight. And if you're over 30, you're obese. If you're over 25.0, you're overweight. But that doesn't keep into account your lean body mass, all right? So it's okay to look at things globally, all right? So we can say, okay, in the last 20 years, United States of America's BMI is up 2.0. That's important to know, but individually, from a personalized standpoint, we want to see body fat percent.
Okay. Now you mentioned also the food sensitivity. Is that an optional thing for the person? Do you encourage that?
That's a good question. So it's an optional thing because it's an out-of-pocket expense.
Oh, okay.
Okay, that can run between $295 and say $550. Now most all of our clients feel it's an investment worth making, but how you spend your dollars is up to you. But we find that people who follow their food sensitivity test do the best. And I got to tell you about one of my clients, Paul. 42 years old, had belly fat, was fatigued. So he told me the story. Before he came in to see me, he said, okay, I've had it, I'm gonna get in shape. Every morning he would do a whey protein shake with almond milk, put that organic banana in there, and then through the day he drank lime water. He was still tired, was relying on coffee all day to get him through the day. His belly fat wasn't going anywhere even though he was working out. We did the food sensitivity test. He was highly sensitive to all 4 of those foods. Okay, whey protein, almonds, bananas, and limes. So what do? We take out the whey protein, put in a plant-based protein. Take out the banana, put in a strawberry. Teach him how to squeeze a lemon instead of a lime. And within 48 hours, his energy improved and he felt like his metabolism got better. So food sensitivities can be an absolute key factor for your metabolism and your success.
Yeah, I mean, people feel that every day. Gluten is a big thing, right? The gluten allergies, I'm assuming that's all the same line, right?
Yeah, we check for gluten, we check for dairy. The test we mainly recommend, we use MRT, food sensitivity test, which stands for mediator release technique, where this particular test is looking for histamines and prostaglandins and inflammatory markers, okay? So we can check for 120 foods and 30 different chemicals. So it's very precise, about 93% accurate. And what it also does, which is super cool, is when a patient, one of my clients, sees their food sensitivity test, they're more inclined to follow it. It increases compliance probably tenfold. And oftentimes they'll say, yeah, when I have strawberries, I don't feel great. So it could be benign food, but not good for you.
Now, you also mentioned the immune analysis. So what areas is that looking at? Is that thyroid or some other areas that you're talking about?
Well, immune analysis, we look at your blood work for that, your white blood cells and other components.
Okay,
there's some people who definitely have immune compromise, and the blood work can help detect that. But as I was referencing before, that front tire, looking at adrenals and thyroid and sometimes brain chemistry depletion, like your neurotransmitters are low, so you're craving food. So we look at all these different components if we need to, so we can set someone up for success, not failure.
What are some of the common vitamin deficiencies that you might find?
Oh yeah, so we do a lot of vitamin mineral testing.
Okay.
Probably number 1 is vitamin D. If you're living north of Atlanta, and we are here, you're probably low in vitamin D. And the reference range for vitamin D on blood work is like 30 to 100, but the research is pretty clear. Good levels of vitamin D is between 60 and 90. I don't see anyone that high unless they're supplementing with 5 to 10,000 IU a day. So vitamin D, magnesium, zinc, those are probably the top 3 nutritional deficiencies I see day in and day out.
Now, I know there's a couple of different types of vitamin D, right? Is there one that's more absorbed than others?
Yeah, the vitamin D3 is the most absorbable form. So if you're taking that, and very good point, most research shows that you want to take your vitamin D3 with vitamin K2. They should be taken together. Like I've had patients going, I'm taking 5,000 vitamin D a day, and their vitamin D levels are horrible. When you add that vitamin K2, it improves absorption digestively, and the vitamin K2 helps get that vitamin D into the cell, and the vitamin K also helps get the calcium out of your blood so you don't get plaque.
Great.
You don't, plaque up.
Okay, so we've learned about the importance of a thorough evaluation and the proper weight loss program. When we come back, we're going to talk to Dr. Bilella about the specifics of a weight loss program that can help you lose weight and live a healthier lifestyle.
Dad, we need to talk. If you're not going to listen to me, who will you listen to?
Jeffrey!
Is that Marcia Gay Harden?
I think so.
You're getting older.
Not that old.
Your brain is changing.
That's what I was saying.
Honey, I've got experience with this. Jeffrey, brain health is all about making the most of your brain as you age.
Really? Whoa!
Where did she go?
Learn what you can do to help keep your brain healthy at brainhealth.gov.
Welcome back to You and Your Health. I'm your host, Dr. David Bertone. Today we're meeting with Dr. Tom Bilella. Dr. Bilella is a chiropractor and clinical nutritionist with a practice in Red Bank called Nutrition Treatment Center.
That's it.
Dr. Bilella, welcome back.
Hey, thanks.
So talk about the foundation of your program
Good.
and what you use for getting people started in a weight loss program.
Yeah, so it's not just weight loss. It's clinical nutrition, weight loss. I do a lot with fatigue and adrenal stuff and thyroid
okay.
stuff. But weight loss, of course, is a big deal. Energy and weight loss, that's where people are struggling. But anyway, we break it down into 5 core segments, and I call it the number 1 is the education phase. We got to get people educated. I once read this: if you're unwilling to learn, no one can help you. If you're determined to learn, no one can stop you. All right, so we really educate people. We have audio CDs. We have certain chapters in books we have you read, and we really educate you so you get the big picture. So there's the education phase, and then there's the diagnostic phase. As we spoke about earlier, getting the right blood work, food sensitivity testing, vitamin mineral analysis, and sometimes we even go deeper into stool analysis. It all depends on what the person needs. So education phase, diagnostic phase, and then oftentimes there's a detox or cleanse phase, which is where you're eating. It's not like a juice fast, but oftentimes you got to support the liver and the kidneys and digestive tract and eat really clean for say 2 to 3 weeks. After that cleanse phase, we go into the personalization phase, and then we align a program for you. We modify it, we put it together for long-term success to get you your ideal percentage of body fat and improve your blood work. In other words, there's 3 things that are important to us, 3 criteria. Your symptoms improve, you feel good, your body composition's improving, and your blood work's improving.
Great. So you mentioned some of the cleanse, and I know there are some popular cleanse programs out there. Can you just talk about the pros and cons of doing a hard liquid cleanse?
Yeah, that's a great point. We never recommend just a cleanse as far as liquid and just not eating food. What happens is if you're going to do an effective cleanse, you must support the liver, and the liver needs amino acids, and you need calories, right? So our cleanses usually recommend certain medical foods, that are pharmaceutical grade, and sometimes things like milk thistle and support for your liver. But in our program, you're eating every 3 hours, you're drinking the right amount of fluid, and the cleanse that we do are very gentle, they're very safe. And not everyone gets a cleanse, but oftentimes that's a way to really kickstart fat loss and get you feeling better.
So you said some of the liquid cleanses are not good for the liver? They're not good?
Not so much good for the liver, right? It can deprive the liver of key amino acids that are necessary for detoxification. Not to mention, a lot of people who aren't feeling well, they have adrenal weakness problems. They have blood sugar instability. So if you start going on 600 calories or 800 calories just with liquid, it could be actually very dangerous. And I've seen a lot of clients come in, they've tried the cleanse that their next door neighbor sold them, and it actually really backfired.
Yeah.
So you got to be careful.
Yep. All right, so we talked about the analysis, the components of the program. Now we get somebody, we know they need to lose some weight, live a healthier lifestyle. What are some of the options for these people, and what's the components of the programs?
Okay, so then we break it down into an acronym called EASY. Okay, again, it's education. Number 2 is how to eat. It's EESEE, how to eat. And when we have the food sensitivity test, it becomes very easy to teach you how to eat. Now, then you still have to get into macronutrients a little bit. How much protein, how much carb, and how much quality fat do we need? We teach you that, and we teach it real simple where we talk about impact carbohydrates. An impact carbohydrate will impact an insulin release from your pancreas. One of the number 1 considerations for fat loss is insulin management. So the right amount of carbohydrates that you can handle, your carbohydrate threshold. So lean, clean protein with the right carbohydrate threshold and healthy fats. So it's educate, eat, supplementation, safe supplementation based on your actual blood work. And the problem with supplements today, there's no purity certification, right? There's no truth in labeling, and there's a lot of false claims. You have to be very careful with supplementation. After supplementation, we talk about exercise. The right exercise for you. It doesn't mean join the gym, get a personal trainer, and do 100 ball squats. That could be way too much for people. You have to start slow and work up. And the last consideration is eliminate. What you need to eliminate. That could be diet soda, that could be the gluten, whatever. So we take you through this easy program. Educate, eat, supplement, exercise, and what to eliminate.
Now you have some specific programs, the Platinum Nutrition Program. So what does that consist
Yes,
of?
the Platinum Nutrition Program is my program. That's the clinical program that we're describing right now.
Okay.
And that's like the functional chemistry, the vitamin mineral testing, and usually the food sensitivity testing.
Okay.
So when I say the Platinum Program, that's that full, more functional clinical nutrition approach.
Now, do you give them specific foods to eat based on the results of all the tests?
Absolutely.
Or nothing's prepacked or anything
no,
like
we
that?
give them, help on convenient meal options and where you can get food, and we teach you how to shop at, Whole Foods or Trader Joe's, or where to get foods that can be convenient, like Kettlebell Kitchen. So we really help you, number one, how to prepare foods and how to shop, but if you need convenience, we teach you that too.
Okay, because I know some of the programs there are, prepackaged, or there might be protein bars or shakes that you're going to have.
Yeah, so we do recommend shakes. Listen, all the
Okay.
research is clear that most successful weight loss programs, our most successful clients will typically do 1 to 2 shakes a day to get the right amount of protein, low carb with the right nutrition. But they have to be a high quality shake, and it has to be matched based on your food sensitivity test. If you're sensitive to whey protein, you can't have whey protein. I was doing whey protein every day for 20 years until I did my sensitivity test. Now I do a plant-based protein.
Got it. Okay. So now you have another program, this ketogenic T360 program. How does that differ?
Yeah, so ketogenic program, this is a 5-week program. Now all the research is clear. There are some people who just do a lot better with fat loss getting to something called ketosis. Now Dr. Atkins talked about this decades ago. Now ketosis is where your cells adapt to burning fat, not glucose, which means you bring your carb levels down to about 30, 40 grams a day, teaching your body to burn fat. And there's this excellent program called T360, which is a 5-week kit, which you're eating breakfast, lunch, and dinner, and in between you're doing these packets, that's protein, carbs, and nutrients that keep you from getting hungry, keep your blood sugar stable. So oftentimes, not oftentimes, some people just do better on that. If I feel like someone's on my program with the right protein-carb ratio and they're stuck, we can do a ketogenic program. I have a staff member, 2 staff members who run that program. There are people who just will come in for that program in of itself. They can do an easy questionnaire online to see if they qualify. If they qualify, they can go right into that program.
And that is more prepackaged stuff? Or
It's got packages as far as what you drink between meals.
supplementation packages?
Yeah, it's very simple.
Okay.
But the bottom line is that you have to eat food, and the food is very easy. It's lean protein and vegetables and maybe eggs and a little bit of fruit.
Okay.
But you're not hungry. Usually after 2 or 3 days, you feel fantastic. The average weight loss is 18 to 22 pounds in 5 weeks.
Wow, amazing.
Yeah.
Now, what about some of the specific products or supplements? I know it's going to be based on the chemistry. And is there ones that are more common than others that you see people take?
Well, here's the story. I mean, yes, it's based on the chemistry, but oftentimes, we usually start people with a good quality probiotic if they're low in vitamin D and magnesium, and B vitamins can be very important. But the bottom line is that you have to look at someone's individual chemistry and then determine what nutrients they need.
Okay. Now, obviously, fitness is critical here. So you start them, you're modifying their lifestyle, you're giving them the right foods based on their chemistry. How do you determine their fitness levels?
Good. So fitness or exercise are 3 components. There's frequency, there's intensity, and there's duration. And people sometimes confuse this. Research is clear, we see this day in and day out, that for fat loss, 30 minutes, 5 days a week, with your heart rate between 60 and 80% is key. Many people are going to the gym and they're doing spin classes or other things and their heart rate's too darn high to burn fat. Now that's a general rule, 150 minutes a week is where we want to work someone up to. But if someone isn't exercising at all, we may start with 5 minutes 3 days a week. So we have to meet the person where they're at, but of course layering in exercise is going to be key for long-term success with energy and weight loss.
And how do you modify? Is that through that coaching component where they come
yeah.
back?
Yeah, every time they come in, we're going to teach them something else. Usually the beginning is the food, and then there's the exercise and how to keep this going long term. But when we do a program with someone, we write the book on them. Okay, we literally give them a binder. It's like I tell my clients, this is like a level 100 college course. I'm the nutty professor. Kristen is the teaching assistant. I'm the bad cop. She's the good cop. We work together as a team. Every time they come in, you bring this binder, and this binder has all the information you need. It's a distillation of what's important to put this program together. This kind of program should be taught in the 6th grade and the 10th grade, right?
Yeah.
If we're going to end the diabetes crisis. But when people find us, our strongest arm is education and personalization.
How about some of the newer things like Fitbit or these special apps that are monitoring activity levels?
Yeah, it's a great tool. There's no doubt about it, because we do have our clients keep a food journal for a period of time, but they can go on, MyFitPal, and the apps can be very helpful. The consideration or the concern I have is then people are wearing their Fitbits all night long, tracking their sleep. And me personally, I don't want to be connected to the grid when I'm sleeping. We're getting way too much electromagnetic stress, in my opinion, as it is. So I'm not a big fan of people wearing something all night long and they're getting bombarded with, they're not bombarded, but they're getting too much electromagnetic stress. But we do recommend heart rate monitors, the old-fashioned heart rate monitor. We sell them in our office because what I want to do is get someone to understand that when they do their aerobic exercise, they should be within 60 to 80% of their max heart rate for ideal fat burning and heart health. This was proven years ago at the Cooper Institute. But unfortunately, many people, especially trainers, think more is better.
Yeah.
Okay? And the more you sweat, that's better. And the more calories you burn, going to the gyms, oh, I burnt 900 calories. Doesn't mean it's good.
Yeah. Now, you talked about this, the heart rate of being between 60 and 80% as that magic number.
Yeah.
I would imagine that's hard for some people that are just starting out, they're on a walking program. Is there anything they can do to get that a little bit elevated without really stressing them too much?
Yeah, I mean, some people just have some issues, right? So sometimes we teach people just start squeezing your muscles, twice an hour to kind of help, get glucose into the cell. So we meet people where they're at. But Barry Sears said it. He wrote the Zone Diet book years ago. The most effective weight loss exercise plan, you go out your front door, walk 15 minutes, and come back home. Walking 30 minutes a day can be the most effective way to burn fat.
Yep. And these days, we know that people are very sedentary, not getting any walking there, taking their car everywhere, and doing most of the stuff online, not even shopping anymore.
This is all adding to the diabetes problem.
Yep.
Now, do we need resistance training too? Yeah, we all need resistance training, but oftentimes not nearly as much as people think. I'm a big proponent of time of tension. 4 seconds up, 4 seconds down, 3 to 4 sets per body part once a week. That can maintain muscle and sometimes grow muscle. My former background, I was a bodybuilder. I was a bodybuilder back in 1995, and I used to train very intense, very long. But the research is clear. Sometimes an hour a week is all you need to stimulate lean body mass.
Yeah, and that's important for bone health too, right?
Absolutely. Bone health, muscle health, that's the bottom line.
Now let's talk about the future of weight loss. And healthy living. What do you see coming down? What do you see coming down the pike in terms of measuring this stuff?
Okay, so so as you can tell, we're describing a personalized program. Your foods, your vitamins, your minerals, and your exercise, and that's pretty darn personalized. The future is here, and that's genetic testing. Like there's one company called Pathway Genomics. We're going to start using them where you can actually do saliva test. You can look into your DNA, and this will give you more specificity on what macronutrients are right for you. Should you have more protein, carb, fat? This will give you more information about the right way to train. Should you train at a higher heart rate? This will give you information about what percentage of your diet should have monounsaturated fats. So the future is very exciting with respect to specificity, looking right inside your DNA code.
So you don't see like that magic bullet or that magic food coming down the pike. It's more of the testing component.
If it was here, Oprah would have found it by now. Okay, so trust me, Oprah would have had it years ago. If there was the magic thing, Oprah would have called me personally, or I would have called her and said, Oprah, we got great news. We found it. There is no magic bullet. It comes down to personalization.
Awesome. I mean, on a personal note, some people have that issue with, they eat a big meal and then they just feel really kind of, really.
Yeah.
I mean, how do people address that? Where should they start with that?
What mean portion distortion?
Yeah.
Okay. So that usually happens when you have the sumo wrestler's diet, where you don't eat all day and then it's dinner and it's a gavone. We can say that. You know what a gavone is? You know what a gavone is? Okay. So then you're getting this bloated feeling, and what happens is your insulin levels are going up so high, your glucose levels are going up so high, then your body's making triglycerides, which is very draining.
Yeah.
So and some people have been doing this for years. That's like a normal pattern. That's the normal way to eat. So it's a little behavior modification.
Yeah.
I once heard this, and I think it's true. There's only two things we're in control over: our effort and our behavior. So we teach people better behavior, and we make sure they give it a good effort.
Great. Dr. Bilella, thanks for joining us.
My pleasure. This is great.
Yeah, so thanks for joining us on You and Your Health. We heard today from Dr. Tom Bilella about the importance of nutrition and coaching and weight loss. I'm your host, Dr. David Bertone. Until next time.